For Session Update, I'm Shannon Lurkey. Governor Dayton, along with several legislators and commissioners, announced the formation of a task force on mental health at a press conference. Failure to address mental health problems in Minnesota has contributed to rising rates of addiction, crime, and child abuse. As a result, Governor Dayton has created a task force that will begin addressing the complex relationship between mental health and societal ills. Here's that press conference.
So today I'm announcing the formation of a mental health task force. Be set up at no additional expense to the state of Minnesota, but we're going to engage citizen experts from around the state, along with legislative leaders, along with commissioners of the agencies directly involved, and ask the commissioners and the legislators to serve as, technically speaking, ex officio members, because we're limited in setting up such a task force to 15 members, and I wanted to be able to provide maximum participation for people who are out in the real world of Minnesota who are dealing with these serious issues on a daily basis. You know, I interview candidates for judgeships, and a lot of assistant county attorneys, public defenders, and I ask them, what are the changes you see in the last number of years they've been serving, 10 years or 15 years, and they all talk about what are essentially increasing number of people suffering from mental illness, severity of mental illness, violent behavior associated with mental illness, and the overload of our system. The county sheriffs talk about how Senator Sheriff Stanek says a third of his prisoners in county jails in Hennepin County are mentally ill. With the 40-hour rules, as Commissioner Piper can attest, the overload on therefore Anoka and other state-run facilities. There's just more and more people showing severe signs of distress. The county social services people talk about 70,000 is the number. It's probably an understatement of children who are neglected or abandoned or abused, reported last year. And all the drug addiction and overdose and all the criminal behavior that's associated with that again is increasing dramatically. It's just an alarming trend. It's part of a national trend of more people who are in greater distress. Then we have the resources, public and private sector combined, to treat, especially to treat in a preventative way, until something serious happens, and then we're trying to respond after the fact. So there's just so much scope to this task force. It just requires us to take a fresh look at everything that we're doing and engage with the private sector as well as the public sector to find out what can we do more preventative to prevent this onset of mental illness before it develops, and to intervene at earlier stages, and then to know what we can do in the most cost-effective but also humane and efficient way. Those people then arrive under the necessity under the care of the Department of Human Services at ever-increasing cost to everybody else. So I want to especially salute and thank Senator Kathy Sharon, whose idea this was to take on, form this task force, and I want to thank the legislative leaders who are here, Senator Julie Rosen, Senator Tony Laurie, appointed by the leaders of their caucuses, Representative Clark Johnson, appointed by the leader of his caucus. I am very disappointed that the House Majority Caucus has not responded to our repeated invitations to include somebody to be here today and get started with us. I think it's essential this be bipartisan, nonpartisan, non-political. This is everybody's problem, everybody's concern. But we're off to a good start. On that basis, we're going to reach out as broadly to advertise the availability of the openings for this task force, to solicit broadest possible participation throughout the state of Minnesota to people who can help us think better about how to handle this serious crisis. With that, let me ask Commissioner Piper to speak.
Thank you, Governor Dayton, for your leadership and your commitment to addressing quality and access in our mental health care system in the state of Minnesota. Here's what we already know. There are really serious gaps in mental health care coverage across the state of Minnesota, which has resulted in inappropriate placement of patients in mental health care facilities and in jails. And that costs a lot of money. There are not only human impacts, negative human impacts, but also real significant expenses for the people of Minnesota. And our acute psychiatric hospital at Anoka is one really good example of the challenges we're seeing, but the challenges we're seeing there are challenges that we're seeing across our whole mental health system. And this task force, the benefit of this task force is it brings people together across disciplines and across different areas to the same table to come up with some comprehensive solutions. It includes law enforcement, it includes the judiciary, it includes people living with mental illness, it includes family members of people with mental illness. And so it includes the hospital association and our providers that are dealing with this on a daily basis. And it also includes a really strong legislative delegation and really great legislative partners, in addition to the leader that we have here in Mark Dayton. So with that, I just want to say thank you to the governor and thank you to the legislators here today, and I look forward to getting to work. Thank you. And with that, I'd turn it over to Senator Kathy Sharon.
Thank you very much. I'm coming to the end of my tenure here in the legislature, and over the course of the time that I've been here, and especially as the chair of Health and Human Services, we've really focused very deliberately in the area of the continuum of services for persons suffering and needing mental health services. What we've discovered is that we are approaching resolving the difficulties in a piecemeal fashion. And we find ourselves responding to crisis after crisis after crisis, and we do not have a comprehensive way of thinking about how to fill the gaps or support those programs that we know already work. I'm so grateful to this governor who has on another occasion decided to put together a working task force to really pull together a comprehensive look at the mental health system from the beginning to the very most acute and most serious, and to those who at no fault of their own, are served under the care of the Department of Human Services. So it's a large continuum. Every place along the way has demands and pull at us when we are looking at our budgets. And what's difficult for us as legislators is to know where should we be applying the limited resources we have. So with the help of the governor, we're going to have this task force. This is really a great farewell present to me to see this be formulated and to see the players come together and think through the entire continuum and how we should strategically move it forward so that we don't see the crises that we are having to deal with now in the Minnesota legislature. So thank you very much, Governor, again, for your important leadership in this area. And I'm really sorry that I won't be able to be here to see this thing completed and implemented. But I know with the help of the legislators that are here today that this will not be lost and that there will be a commitment in the legislature to move forward.
I don't think you're going to get off so easily. I get to make appointments,
Well, I too am very pleased to be here today and want to publicly thank the governor for doing this Blue Ribbon Task Force. It is something that, in the Senate with my good friend and colleague Kathy Sharon and my good friend and colleague Julie Rosen, we have really put politics aside on this. And as Governor Dayton said, this is everyone's issue. Mental health respects absolutely no boundaries. It affects the rich, the poor, every corner of our state. It affects our businesses. It affects our schools. I would venture to say that there is not a person in Minnesota that doesn't have a loved one or someone who is experiencing significant mental health issues. And we all know and care deeply. And sometimes the solutions really perplex us. I know last year, one of the things that I was very, very proud of is that we did agree on a bipartisan basis. We had a Republican House and a DFL Senate and a DFL governor sign